Hello, everyone. Welcome back to the Beat Podcast. I'm so excited that you joined us today because we're recording another live episode at the health event in Las Vegas. And today I've got Lynne Nowak with us. She's the Chief Data and Analytics Officer at Surescripts. Lynne, such a pleasure to see you again.
Likewise, and thanks for having me.
My pleasure, my pleasure. So how's the event going for you?
It's good. It's always fun to come here. Great buzz, see a lot of old friends, meet a lot of new folks, just great connections, great networking. So health is always a fun event.
It's one of those anchor ones now.
Yeah, for sure.
Yep. Awesome. Well, hey, let's get into it, Lynne. First of all, tell me a little bit about your role at Surescripts.
Yeah, so I've been with Surescripts for a little over 2 years now. Very exciting time in the company. A lot of growth, a lot of innovation happening, which is really fun. It's been particularly great for me because I've worked with Surescripts for many, many years before I came here as Chief Data and Analytics Officer. I'm an internal medicine physician by background, cool. So I bring that clinical background, but having an opportunity to kind of pull that forward into the data and technology space has been great. My team is really charged with finding new insights and new ways of using the data that Surescripts has been transporting for many years as part of our network. So it's really just another area where we're growing and doing a lot of innovation that Surescripts had not done in the past, which is fun.
That's exciting and really interesting to hear your physician background, very important in driving that innovation and that kind of being mindful of all the stakeholders in the ecosystem. How's your organization reimagining care delivery to improve both access and outcomes, especially for historically underserved populations?
Yeah, so this is one of my favorite missions of the company because, again, just sitting where we are within the healthcare ecosystem as that interoperability, connective tissue between providers and payers and pharmacies and really increasingly patients, it's a great opportunity for us to leverage the data we have, the impact we have, the reach we have to help patients, as you mentioned, in underserved communities. Mm-hmm. So when we think about health equity, when we think about how data and information can help patients make better decisions, help doctors make better decisions, it really does help go a long way to help bridge those gaps.
Yeah, I love that. And so a key part of gap bridging is technology. And we're seeing a lot of technology here at Health. AI, I don't think I've seen a booth without AI on it. Even the pens are hanging out, say AI. There's so many emerging technologies and they're shaping the future. How do you decide which innovations to invest in and how do you measure their real world impact?
Yeah, I love that question because, there is a lot of hype for sure, but AI is real and it's something that we're all excited about. I think there's tremendous promise and excitement about it. And we certainly at Surescripts are leaning into it as obviously, as you mentioned, are pretty much everybody else here. We think about it though, we really start with what's the impact we're trying to achieve. And AI is a new tool in the toolbox and that's fantastic, but it's not necessary in everything. And it's still an emerging technology. So we want to lean into it. We want to be excited about it. And we really want to think about what is the outcome and the impact we're seeking to achieve. And really focusing on those most important, most valuable opportunities, whether it's a way to drive operational efficiency within the company, which is where a lot of companies are starting, or is it around how do we reduce that administrative burden for a physician with prior authorization as we're leaning into medical record reviews and extracting data out of an electronic health record to help automate a prior authorization. We're not using AI in our current automation of prior authorization because it really wasn't necessary. And we're kind of some good old fashioned hard work, grit, automation work of prior auth. But as we start leaning into more prior authorizations that are more complex, that require more information and kind of a deeper dive into that clinical record, we're absolutely embracing how AI can help us with that and help where the doctor doesn't have to do anything, the patient doesn't have to do anything. We make it easier for the payer to make a determination and most importantly, make it easier for that patient to get started on therapy.
That's great. Yeah. And I love your segmentation of what's needed where. Simpler tasks versus things that require a lot more research and pulling a lot more data. I think that's a really great way to look at it. What are the key challenges that Surescripts is helping life sciences companies address? Because this year you guys are in the life sciences area of the conference.
Yeah, so it's an exciting expansion of the reach that Surescripts can have. And So this is really over the course of the last year or so, we've been really looking at how do we expand the Surescripts ecosystem. Historically, we're known for working with providers and payers and pharmacies, of course, and life sciences is a really exciting growth area for us. It still comes down to access to care for patients and better outcomes for patients. We're doing a lot of work with life sciences patient access programs and helping automate and digitize their benefits verification with our electronic benefits verification product. We're doing a lot of work with helping life sciences understand what's happening with their medications with prior authorization. And that's just the tip of the iceberg. So a lot of great conversations with pharma, understanding what are their pain points, what really can we help them with, what's an appropriate space for Surescripts to be in there, kind of building out our roadmap over the next few years to adding life sciences in as one of our key stakeholder partners.
That's great. And at the base of this all, it is so important for any tech to have clean data. And so I know that's your core focus. And we've had a lot of conversations on the podcast yesterday and today with pharma talking about the importance of clean data. And it sounds like you guys are playing an important role in that.
Yeah. So my team, we have a lot of exciting work going on with expanding our data and analytics and building out new data products and bringing new insights to the market. A great example of that is we just recently released our new product, First Fill Abandonment, where we can help providers and payers see which patients have maybe gotten a new medication, but it hasn't yet been filled. So that's something that's really not available today, insights that Surescripts can uniquely deliver. So that's exciting, all the data product development we're doing. But to your point, all of that has to be built on a solid foundation of high quality data, secure data, managing data privacy, consent, the data rights permissions that were given by our customers, which we hold very sacred. It's a key part of the trust in the Surescripts network that is really, really important. So just as much excitement as we have around the data products and the data and analytics and insights we're bringing, it's that doubling down on our infrastructure, data governance, privacy, all the data segmentation, metadata management, kind of geeking out on all that behind the scenes stuff. Because if that's not there, the products aren't trustworthy, the network's not trustworthy. As we lean more and more into AI, the data readiness, the data quality is incredibly important to having good outcomes and results from your AI. So it's just really core and foundational to everything we're doing right now.
Brilliant. Yeah, no, that's such an important focus. And what's the impact on patients of life sciences companies using electronic benefit verification?
Yeah, so I mentioned this is really largely focused on the patient access programs within life sciences companies. And they, of course, are trying to help patients afford their medications. They have copay assistance. They have different quality and care programs that are coming directly from life sciences. And to get those programs initiated, the pharma company needs to verify that that patient is eligible for those programs. So depending on what that patient's benefit is, some patients may or may not be eligible for a copay card, for example. And that historically has been done through a pretty clunky manual process, live people getting on the phone with other live people at the pharmacy benefit manager to verify the patient's benefit and see if they're eligible for some of these programs. What we've been able to do is use our benefits verification product transaction that we've had in the market for many, many years with providers and just pivot that to a pharma-facing transaction, digitize and make it electronic so that with the click of a button, a very simple transaction that takes seconds to help that life sciences company verify if that patient is eligible for those services or not.
Well, this is the type of removal of friction I think is necessary for access. I'm very intrigued by this first fill abandonment. I mean, that is such a miss. And to be able to have insights that like flag it is really exciting.
Yeah, this was really sort of our entry into our first, data product that we've released here recently. And what's exciting about it is it's something that Surescripts is uniquely positioned to do and bring insights to the markets that you really haven't been able to get anywhere because these transactions are really fragmented. The prescriptions that get written and the prescriptions that get filled are really difficult to put together. It's difficult to match those. And that's something that we've been able to do since we're connected to the EMR on the provider side and we get that fill data from the pharmacies on the dispense side. There's a lot of great adherence programs out there. There's a lot of great adherence analytics out there, but almost all of them are based on claims data. And if there's no fill, there's no claim.
Right.
So those scripts that get written, somewhere in the neighborhood of 20 to 30% of prescriptions never get filled. So that means those patients do not get started on therapy, and they're largely untreated until they either show up in the hospital, show up back to the doctor's office, their diabetes has gotten worse, their high blood pressure has remained untreated for potentially months, and nobody really knew they were out there. When I was in practice, I'd write that script, patient would leave, and you just hope they go and get started on therapy, but there was no way to know when they didn't. And now we can bring that information to the providers. We can bring that information to health plans and case managers to say, hey, it's been 2 days, 3 days, 5 days, and this patient still hasn't picked up their scripts. Somebody might want to call, check it out, find out why. Maybe they can't afford it. Maybe they don't have a ride to the pharmacy, but they can intervene and while it's still timely and get that patient on therapy.
Yeah, that's fantastic. And my mind just goes to, if Shopify could do this, way easier. Obviously, healthcare is complicated, but interoperability, those connection points, it's actually becoming possible now with the work that you guys are doing. So congrats on that product. Excited to see the impact that it makes on the industry.
Thanks. Yeah, we're really excited. And then we'll just build on that. So, once we kind of tackle that first fill, ongoing adherence is a natural progression and extension of that. So looking at once the patient gets their first fill, do they get that refill? Do they stay on their therapy? Do they switch to a different therapy? And if not, why not? And again, it's not just about the descriptive, what's happening, but it's understanding why, digging into the data, and then from there going on to more predictive analytics around who do we anticipate won't pick up their medication? Who do we anticipate may get started but doesn't continue? And how do we design solutions and interventions to get ahead of that and keep patients on track and keep them healthy?
Lynne, we could geek out on data.
I love it.
We could go down so many roads on this one. Let's keep it going. So how is Surescripts supporting life sciences companies, healthcare providers, and health plans to help patients access medications?
Yeah, so lots of different activities going on there. I'd say one is the work we're doing with prior authorizations. So helping automate those prior authorizations, reduce that friction, turn what has historically been, if you're lucky, an hours-long process, but sometimes can take days to weeks to get that prior authorization decision. We've been able to automate that and usually get that done within about 30 seconds. So that's super exciting. So that's going to help patients.
For prior auths?
For prior auths.
Man, that's awesome.
Yeah. So it's really exciting with what we call our touchless prior authorizations. So we've got 76,000 providers have access to this and growing. We're covering over 70 medications now and growing. Awesome. So really, really exciting work there. Also, a lot of work going on with price transparency. So helping doctors understand the prices of medications, leaning more into getting that information in the hands of the patients themselves so they understand what their options are as far as pricing, different drug options, different pharmacy options, and helping kind of reduce that cost barrier to patients if they see that there's maybe a lower cost alternative available.
Hey, why can't we have that one-click buy button? It's possible, guys, and great to hear what you guys are up to on that front, on the prior authorization piece. Then looking ahead the next 3 to 5 years, what bold bet is Surescripts making that you believe will truly transform the healthcare experience? Beyond already the few that you've mentioned. What's the bold one?
Yeah, I would say our bold bet is expanding our ecosystem to include the patient more than we have in the past. So we've historically worked with the physicians. We would impact the physician to help them, empower them to have better and more informed conversations with the patient. But expanding that ecosystem into the patient world is one. And also with life sciences, just understanding what a critical role life sciences has in this ecosystem. They're developing novel, life-saving, life-improving therapies. And they've largely been kind of kept out of the loop on a lot of the solutions. And so bringing them into the fold, it's been amazing as we've been having these conversations with life sciences. They don't really have great understanding of how the whole prescribing ecosystem even works. They understand negotiating with PBMs and getting on formularies. Of course, they get all that.
The macro stuff.
Right. But understanding, okay, what is actually happening in the doctor's office when that decision gets made? What's actually happening at the pharmacy when the patient tries to pick up a medication and can't get it for whatever reason, what the options are. And so Surescripts playing a role to kind of bring life sciences into the fold and make a partner of life sciences along with our other network partners is really exciting. So I'd say probably the two areas that we're really leaning into more would be direct to consumer, working directly with patients, and also working more with life sciences.
Fantastic. Well, certainly exciting and great to hear that you and the team are going that route. Lynne, such a pleasure to connect with you again this year. If people wanted to learn more about the work that Surescripts is up to, where can they find out more?
Yeah, so a lot of really great information on our website at surescripts.com. And, a lot about our solutions and some of the different domains we're entering into. And we'd always be happy to have more conversations.
Beautiful. Well, there you have it, folks. Check out the show notes where you'll find the short notes on our discussion with Lynne Nowak, Chief Data and Analytics Officer at Surescripts. Make sure you check out their website too, because there's probably something in there that you and your health system or your laboratory, your pharmacy can benefit from. Take advantage of it now. Lynne, such a pleasure to have you on.
Thank you so much for having me.